A one-day-old girl noted to become profoundly cyanotic while feeding and crying. A diagnosis of congenital heart disease is suspected. What is the most likely cause? So here first of all, see the one-day-old baby girl. That means just after birth, and she became profoundly cyanotic while feeding and crying, and it is suspected that one of the congenital heart disease. What may be the diagnosis? Here the options are transposition of the great arteries, coarctation of the aorta, patent ductus arteriosus, hypoplastic left heart, and ventricular septal defect. So which will be the answer for this? First of all, let's see some cyanotic and acyanotic heart disease. Here we can see the acyanotic heart disease. They are the ventricular septal defect, which is the most common. Then atrial septal defect, patent ductus arteriosus, coarctation of the aorta, and aortic valve stenosis. These are acyanotic. That means they are the acyanotic heart disease. But some are important cyanotic heart disease. Let's see what are the cyanotic heart disease. Here we can see the cyanotic heart disease. They are the tetralogy of Fallot, transposition of the great arteries, tricuspid atresia, and pulmonary valve stenosis. And here keep in mind that the cyanotic, the most are start with T. That means tetralogy of Fallot, transposition of the great arteries or vessels, tricuspid atresia. So the most are them started with T. Now this is the most important point, that the cyanotic, the most important or most common at birth is transposition of the great vessel. Here we can see this is the transposition of the great vessels, and they are the most common at birth. So at birth, that means the 1 day, 2 day, 3 day, within this time these are the transposition of great vessel. But overall common in case of the children, overall common is the tetralogy of Fallot. So this is the twist. So first of all, here the most common or most early, that means 1 day, 2 day, it is the transposition of the great vessels or transposition of the great artery. But when they told that which is the most common in children, or most common in neonate, then it will be the tetralogy of Fallot. So most early, this is the transposition of the great vessel, and most common tetralogy of Fallot. And what are the acyanotic? Most common is the ventricular septal defect. So here we can see some important congenital anomalies. Here we can see this is the transposition of the great vessels. That means the aorta normally present in this one is the aorta. First of all, side determination, this is the right side and this one is the left side. So we know the aorta normally arises from the left heart or left ventricle. So aorta normally arises from the here, but here in this figure we can see it arises from the right side. On the other hand, the pulmonary trunk, this one is the pulmonary trunk, it arises from the right ventricle, but in this picture we can see the left ventricle. So it is the transposition. That means the aorta takes place of the pulmonary trunk, and the pulmonary trunk takes place the origin of the aorta, and this is known as the transposition of the great vessels or transposition of the great arteries. So when there is transposition of the great arteries, so the symptom very early. The symptom is the very early symptom present in case of the transposition of the great vessels. So this figure just enlarge the previous figures, and here we can see this place should be the aortic part or aortic origin, but here we can see this is the pulmonary tract origin, and here the pulmonary trunk origin place, and it takes place the aortic orifice. So what is the our answer is now ready. It is the transposition of the great vessels, because the transposition of the great vessels, the clinical features appears early than that of the other congenital anomalies. So 1 day old baby girl, that means it is the very just after the delivery, and profoundly cyanotic. So it is the cyanotic heart disease. Most of them are started with the T, and whilst feeding and crying, that means when there is more oxygen required or when there is exertion, then there need more of the oxygen, and in this condition the cyanosis develop. So our answer is the transposition of the great arteries. Thank you all.